Good afternoon, ladies and gentlemen, members of the media present here this afternoon with us at the Diplomatic Center, and those of you following us on the various platforms, welcome to a regular briefing on our management of our COVID challenges. Today is going to be a press conference with a little bit of a difference. Because of the aggravation and the level of discord that is being engendered in the country at this time, I want to use today's press conference to respond to some of what we're dealing with, not just COVID. COVID comes in many forms, as we are seeing. But so this press conference, we're starting it here just after 2:30, and we'll have the normal health team and briefing, and we'll allocate an hour for that. That will take us to 3:30. And then after that, the health team would have done their duty and would leave us, and I will continue with you, the media and the public, on other matters of interest to the population. So let's start, Dr. Parasham and your team. Let's go as we normally would with our state of affairs with respect to our COVID responses.
Hi, good afternoon. Thank you, Honorable Prime Minister, Honorable Ministers, medical team, members of the media, members of the viewing and listening public. At both public and private facilities, our October 15th update tells us that 373,044 tests have been done so far. New positives over the last 24 hours, 297. Our total positive cases so far, 53,689. Those total recovered, 47,790. Active cases now standing at 4,315. Of those in home isolation, 3,700. In terms of our hospital patients, 263, 55 in step down, 59 in state quarantine. In our deaths now stand at 1,584, and condolences to the families of all of those who would have lost loved ones during the pandemic. The Honourable Minister will go into the vaccination status, and I'll now ask Dr. Hines to give us the epi update, followed by Dr. Richards. Dr. Hines?
Thank you, CMO, Honourable Prime Minister, Honourable Ministers, colleagues, members of the media, members of the viewing and listening public. The update for data as at October 15th, that's yesterday at 4 p.m., gives us an epi curve that has basically maintained its pattern over the last several months. We've seen what we referred to as the plateau, similar daily numbers from just about the month of July through August to September, and now continuing on a similar pattern into October, averaging around 200 new cases per day over that time period. Looking at that aggregated on a weekly time scale, you can see that those bars for July, August, September, and October are all approximately, though not exactly, all approximately the same height, minor variations from week to week. That again reinforces the impression of the plateau. And at the background of that, we have that peach section that gives us the idea of percentage positives, and that has hovered between 25 and 30% over the same time period. If you look at that data, again aggregated at a monthly time scale, the same story is told. July, August, September, similar figures. October on track to end somewhere in that general range, and the background positivity hovering between 25 and 30%. The demographics also remain largely unchanged, 50-50 in terms of male-female distribution among the positives, vast majority being in that 25 to 49 or the working mobile age group, and smaller numbers in the under 25s. Looking specifically down at the under 19s, you see that constriction of that part of the pyramid representing a protection of that age group, and that protection is largely due to the lack of movement and interaction in the school-age population, and that's something we continue to monitor. Looking at the fatalities, you see a 58% to 42% distribution, male to female, and above 60, that's about two-thirds, 66% of the fatalities in that age group, bearing in mind again that the background of comorbidities, pre-existing illness, is one of the things that actually increases the risk of death, and conversely, having a vaccination is one of the things that reduces risk of death, and therefore we strongly advocate that those who have not made use of the opportunity to be vaccinated, please hasten to do so. Geographic distribution, nothing has changed significantly in the last couple of weeks with respect to the distribution around more densely populated population centers. And looking from one week to the next with respect to the comparison of cases county by county, we see that while a few counties have had small increases, others have had small decreases, and that maintains the sort of plateau that we've been seeing, where overall there isn't a trend either upward or downward, but a sort of continuous number aggregating from week to week. But we see that there is a slight difference from one county to the next in terms of direction. And that is again reflected over a longer time scale when we look at all the counties and their numbers from week 25 through to week 40. Looking at projections and performance, what we did recently is take another look at how we have been proceeding over the last several weeks. When we looked at the start of July, or the middle of July, the rate at which we had begun to change indicated that we might follow that red dotted line that suggested a slow but steady upward trend. Instead, what we've seen is a constant change, basically a linear sort of change moving upwards in almost a straight line. So we just projected that out to the end of the month, and we will again continue to monitor to see if our projections are met by the actual reality of what the cumulative figures look like. And that, again, speaks to that sort of plateau that we've been seeing. So with no further ado, I'm going to turn you directly over to Dr. Richards to give the clinical side of this update.
Thank you very much, Dr. Hines. Honorable Prime Minister, Honorable Ministers of Health, National Security, Energy, and the Office of the Prime Minister. Good afternoon to members of the media and to the viewing and listening population of Trinidad and Tobago, and of course the health team led by Dr. Paris-Ram. Thank you very much for the opportunity to present an update on the clinical statistics, that is the occupancy levels at the hospitals and step-down facilities in our parallel healthcare system. And this information is as of 8 a.m. today, October 16, 2021. As Dr. Hines indicated, we have noticed a stable or minimal variation in the rolling average. We have also noted a consistent trend in the net admissions over the last 2 months, approximately from July 15th to now, 3 months, and over the last week there were 83 net admissions versus 49 of the previous week. So that was 34 additional patients that have been adding to the parallel healthcare system requiring care from one week to the other. The total number of persons in the parallel healthcare facility as of today is 324. The red line demonstrates those patients that are in hospital, while the yellow line represents those in step-down facilities. The number of patients in hospital, that is the severely and critically ill, exceeds the number in step-down facilities in a ratio of 6:1. This may indicate that there are much more and there's a higher proportion of significantly critically and severely ill patients as opposed to those who are recovering in step-down facilities. This graph demonstrates the occupancy levels from the 15th of May to the 16th of October. At this point, we have had a 92-day period in which the occupancy levels have plateaued of approximately 40% or less. This occupancy level, although it may seem low, is in light of a state of emergency as well as an increased vaccination uptake in our population. The overall occupancy of the parallel healthcare facility across 16 facilities is currently 32% as of this morning. In Trinidad and Tobago, the occupancy level is 32%, while in Tobago, 36%. A similar trend in Trinidad noted with a plateau period from 15 July onward, a variable trend in Tobago noted as well for this period. At our wards, which represent the majority of beds, the occupancy level is 29%, so 3 out of 10 ward level beds are filled. However, the intensive care unit, which is our most resource-intensive department, continues to have high occupancies. As of this morning, the occupancy level was 65%. indicating that 6 out of 10 ICU beds across Trinidad and Tobago are currently occupied. Ladies and gentlemen, our recent analysis of statistics indicated that approximately 95% of hospitalized patients from July 22nd to September 30th have been not fully vaccinated. The only sort of armamentarium and tier that we have now, additional tier, to protect our population at this point would be vaccination. We ask you on behalf of the Ministry of Health team to please don't delay vaccinate today. Thank you very much.
Thank you, Dr. Richards. I would like to ask the Minister to brief us on our vaccination program at this time.
Thank you very much, Honourable Prime Minister. Good afternoon. Good afternoon to Ministers Young, Minister Hines, CM on his team, ladies and gentlemen of the media. Good afternoon, listeners and viewers of the general public. I'll try and go through the numbers because I do have some slides I want to share with you. So I'm going to give you a little analysis of Monday, 27th of September to now. Because on Monday, 27th September, we started to see an uptick in the number of people vaccinated. If you recall, I would have said at that time we started to see about a 50% increase. So from Monday, 27th to Friday, 15th October, that 19-day period, we did 41,929 first shots of a two-dose regime. 41,929. When you add to that the amount of the one-shot J&J vaccines of 13,916, you get a total of 55,845. Divide by 19, you get an average of 2,939 per day, roughly 3,000 per day. So roughly 3,000 people per day since October 27th to last night are on their way to being fully vaccinated. That is not a bad place to be. So we have covered some ground, but we still have a long way to go. So currently, 43.5% of the population have had their first shot, which represents 609,136 persons, and 564,703 persons could be considered on their way to being fully vaccinated. Either they have finished their two-shot regime or their one-shot and done regime, which is 40.3% of the population. So the lesson is, how do we maintain this momentum going forward of roughly 3,000 a day or hopefully increase it? First slide, please. So those are the gross statistics that I just gave. It's broken down by RHA there for you. This will be published. Next slide. This basically shows you the graphical representation. Of note, the 29,797 persons are taking advantage of the J&J one-shot and done, which is adding significantly to our fully vaccinated cohort of people. Next slide, please. Next slides, if you have them. While we look for them, what are we doing to maintain this roughly 3,000 a day? The outreaches that we are doing are proven to be very, very successful and welcoming by those people that we touch. So today, we have a roving team in La Hoquita, literally going door to door, street to street. We also have a roving team in Laventille and some parts of Morvan. We are at the Princestown Promenade today and yesterday. That proved very successful last weekend in Princestown. We are at the Couva Main Road today. We are in Barraport today with a roving team again, street to street. Marabella. We're on the train line to Racer Street, Bayshore Basketball Court. So we are reaching out to people because what people want now is that one-to-one attention, ask their questions. And what are some of the questions we are getting? That slide. People still want to know, if I have asthma, is the COVID vaccine safe for you? you will see this being rolled out in the newspapers. People want that one-to-one interaction. So yes, if you have asthma, you need to be vaccinated. Next slide. People are still asking, if I have diabetes, do I need to be vaccinated? And we are getting a lot of persons with non-communicable diseases who still are unsure that they need to be vaccinated if I have diabetes. So this is what we are doing literally one-to-one. Hypertension or pressure. People are still unsure if I have hypertension or pressure, as we call it. Yes, the vaccine is for you. So this is what we are doing. I will let you in on what we are planning for month end now, for October month end. We are planning some care fairs across 4 sites in Trinidad and 1 site in Tobago, where we'll be going after that 20 to 49 cohort. These are people who our research has told us who feel that they are healthy, and because they feel they are healthy, they don't need to be vaccinated. So we want to pay some special attention to that cohort at month end. You will see us launching something called a TT Moves Care Fair in conjunction with the Inter-American Development Bank and some other partners. That will be made clear. Ministry of Youth Development, my colleague Minister Foster Cummins is on board with that. So we are taking the vaccines out into communities. We are trying to reach those persons who still need reassurance, who need information so they can make an informed decision to be vaccinated. So we want to get our vaccination rates up, or at least maintain it at 3,000 shots per day. And that is what we are doing and how we are doing it. Thank you very much, Honorable Prime Minister.
Thank you very much, Minister Dayal Singh. Before we get to the questions, I just want to add a little bit to what the Minister said about the vaccination program. For those of you who have been following us from this platform for the weeks and months that we have been doing what we're doing here now, you may remember that when vaccines became possible and we were targeting an outcome with respect to a national vaccination program, that we said that we had a population of approximately 1.36 million people, and the amount of people who require to be vaccinated in that population to give a sufficiently high density of persons who would have developed some level of immunity by virtue of it being induced by vaccination was about 960,000. So let's say approximately 900,000 people we're looking at, and we set about to do that. And our planning was that if the vaccines were required, 2-shot dose types, that we're looking at 1.8 million doses. And of course, the minister would have told you, and I would have told myself, how many of that 1.8 million we've actually got our hands on, because we've had a pretty steady vaccination supply since March and April. We had a little window when the supply was not available, and then since August we have had vaccination on call in this country, and vaccination, different varieties and so on, and a program as described by the minister. But at the end of the day, where we are now in November, even though we had thought that once we got vaccines, by this time, November, sorry, we're in October.
October.
Yes, I'm looking a little ahead to November. Sorry, excuse me there, please. We are in mid-October now, and we are looking at November as the month when we would have broken the back of the number that we were targeting before we got vaccines. But I can tell you today with a little bit of a disappointment that notwithstanding all the conversations that we've had and the reasons given and so on, we still have in this little Trinidad Island nation of 1.36 million people, we still have approximately 400,000 people who could be vaccinated in that target going to 960,000. So while the minister might say that, well, that's not a bad number, that's not a bad place, if you look at the place in that context, we are still away from where we thought we would have been when we were literally hamstrung by the availability of vaccines. Since we have got ourselves to a place where vaccines are available to us, I think we still have in our hands now, what's the number of vaccines we have in our hands?
So we got in 1,795,990. We have used to date 1,173,839. So in hand, we have 589,083.
Okay, so Trinidad and Tobago has 500,000 doses of vaccines available. Some of it, by virtue of its expiration, is becoming problematic. We have a little extension on the AstraZeneca, but before that, we did the AstraZeneca that we got from Canada did come with that expiration window being very close to us. And if our population was not using it, then it would have been expiring on us. And since we don't want to waste a single dose of vaccine, we were aiming to give it away to somebody who can use it. And we've done. The Ministry of Foreign Affairs has been very aggressive in getting it to populations elsewhere. The same way we got from Bermuda and St. Vincent and Grenada when their doses were being threatened by being expired. We are doing the same thing with that particular one. Fortunately, the couple of other vaccines that we have, the Sinopharm has a long window, and there is a fairly good uptake on the Pfizer, which was a small volume, and we were specifically. But we still have a lot of our children who are not vaccinated, even though we have set aside specifically, and we continue to do so. The figures I had from the minister indicated that we are, if we were looking at about an 80,000 secondary school children, 90,000 secondary school children, sorry. We are just about 48,000. So we're about halfway there for the school-age population, which could be vaccinated because it's authorized by WHO and we have the vaccines. Unfortunately, many parents have hesitancy and concerns. And even where I'm seeing where some children would like to be vaccinated, they are encouraged by their parents. Now that creates a kind of a problem for the country, not for the government, for the country, where parents who have final say in their children's well-being and who are supposed to be the most concerned, it is their say that we have to pay attention to. And there are consequences to that, of course, because we have a national program which says that we've got the vaccines for the children. The vaccines are authorized by WHO. We always have a vaccination program going on. And as I said early on, if WHO approves a vaccine for children 5 to 12, the government is considering getting that vaccine. And once we get it, we are going to make that mandatory in Trinidad and Tobago. The same way we made it mandatory for other vaccines, for other ailments. So that is on the table. I don't know that WHO will ever do that. If they do it, then we'll be alerted. And if we get the vaccine, then we'll use it. The schools, we have, what can I say? There are some people who expect the perfect state before we deal with the school population. I simply want to say that the government has never lost focus or taken its eyes off that population of school children. We had concerns about the SEA exam, which is a one-day coming out. Some people had a lot to say about that and how bad it was and it couldn't be done. History will show that we did find a way in this pandemic to have the SEA exams. It went like clockwork. Children came out, they did their exams, they went back home, and I've heard that they got very good results, and that problem has been solved during the pandemic. Of course, if we had taken our instructions from some quarters, the SEA exam would not have been done. And the same thing with the CXC exam. There were people telling us that it cannot be done, or this can happen and that will happen. Of course, we know that there are difficulties. It is not the ideal situation. It is not the normal situation. It is not the perfect situation. It is not the sterile situation. But we have to get on with our lives. And that is called living with the virus. And as we do that, some things are not going to be in its normal place, so we have to see what is the alternative place. But fortunately, so far, in the school-age population, we have managed to get those 2 sets of exams out of the way, and we can now look towards 2022 without the issue of what do we do with children who were not examined in 2021 and children who did not get to do an SCA exam. How do you apportion them to the school places of their choice? So we're looking towards 2022, having gotten over that. And then we took the decision, under the guidance of the doctors, that we don't bring out the whole population, the whole 90,000. We bring out the bigger ones first, forms 4, 5, 6. Some people have a lot of problems with that. I'm advised by the Minister of Education that the tutor's position on that issue is that only children who are doing practicals should be brought out to school for all kinds of reasons. Well, we've taken on board everything that has been said. And at the end of the day, the government's policy is that we will proceed with the 4, 5, and 6. And I want to thank those persons, principals, staff, support staff, transporters, parents, who are in fact cooperating with the attempt to get the children back to some semblance of offerings of a school environment in which they are taught. Some people think that that ought not to happen, but we hear you, but we don't agree with you. Of course, there are those parents who have taken the position, either one, that the alternative, which is available, the alternative of the schooling online, some people think that is better than going to school. Some people think that it's safer. Some people think that having made my choice of that we can now speak about discrimination. You can't speak about discrimination if you choose. There are 2 options available in Trinidad and Tobago. One option is you come to school vaccinated, and the other option is you choose not to come and stay home to another offering if you think that that is useful or better. And that will only apply during the pandemic. Nobody has said that this is how schooling is going to be from here on in. It is our pandemic response. And that brings me to a point. Some people are now so comfortable in this situation that they are forgetting that we are in a pandemic. Some people are viewing the deaths that are reported every morning by the Ministry of Health the same way they view the weather at night on the 7 o'clock news. And of course, completely forgetting that the government is responding to a situation that is killing people and that has killed over 1,500 people in this country. Had it not been so, let's suppose the news to us in Port of Spain was that something happened in Toco or in Tobago or in Point Fortin or in Caroni and 1,000 people were killed, and that thing is still here around us. What would have been our response to it? Would we say, well, let's get on with our business like nobody's business and that is not to be taken seriously? We are concerned that every life that is exposed in this country, each and every one of us, we could be added to that number. And that is why the government is not going to give up its responsibility in following the science and doing the best that we can do to eliminate or ameliorate the risk that we are facing in the pandemic year of 2020, 2021, as we go forward, and we're hoping that 2022 can escape that adjective. But as of now, we're getting down to the end of the year, and the vaccination program will continue. You would have heard the minister saying, for those who did not come out, we are coming to you. For those with questions, we are trying to answer it. For those with concerns, we're trying to comfort you, because that is what is required. If the doctors had a little more time today, they would have told you about who is in the hospital and who is facing the worst of the pandemic. 2% of the people in the hospital, or who have died, I think it was, from it, are people who are vaccinated. So if it's 100% is the cohort, and only 2% are the ones who are vaccinated, who are the 98%? And that is why it is being said here in Trinidad and Tobago and outside of Trinidad and Tobago that the pandemic now is being seen as largely a pandemic and a larger challenge for the unvaccinated. You don't have to have a university degree to come to that conclusion. You don't have to have gone to college to have come to that conclusion. The vast majority of people who are exposed and are responding badly are the unvaccinated. But 400,000 people in Trinidad and Tobago saying, I prefer to take my chance with that. But the only problem with that is that it's an infectious disease. You might be wanting to take your chance with that, but you also carry with that position of choice the possibility of spreading it to somebody else. If it was a non-communicable disease, then we might not have had a problem at all. But we have a problem where we have 400,000 people and 500,000 doses of vaccines, and we are going to make our way forward in an ongoing vaccination program. But in the meantime, as we focus on lives, we also are focusing on livelihoods. You would have seen how we have cautiously, carefully, responsibly been opening up our economy, and we will continue so to do. We will continue to open up the economy. We will continue to allow some semblance of normalcy in people's lives, because it is now a question of choice. People have chosen to be the vaccinated or the unvaccinated. The government is not, at this time, fighting those two streams of people. But we are opening up the country. We know what is available. We know, it's kind of getting very difficult now. The only language you have in this country is English. This morning I received a WhatsApp from a stranger who said to me, what are you saying now? Two people who were vaccinated died. What are you saying now? In other words, we should abandon the vaccination program because 2 persons who were vaccinated died. Well, not very many of us have degrees in logic, but we have common sense. Because that might be so. But what we have never said to you, we have never said to you that the vaccine will prevent you from being infected, and it will give you 100% protection from this virus. What we have always said to you is that, like other vaccines, we expect in the environment that you will be infected by the microbe. But if you are vaccinated and your body develops an immunity, as is expected, the science shows us that will happen. If and when you are infected, your body should perform better. Meaning, you should not require hospital ward care. You certainly should not require intensive care units to look after you, and you should not end up in the high dependency units. That is a great benefit. And the people who are not vaccinated are the ones who largely, 98% of the people, are the ones who are ending up in the ICU and the HDU. So, to say that somebody died, a lot of questions arise. When were they vaccinated? Were they in a condition of comorbidity that had nothing to do with the vaccine before they were vaccinated, and then they demised? Or were they so severely affected by the COVID that by the time they were vaccinated, the immunity could not kick in? These are all questions that the doctors would answer. The clinical understandings of it is not a case against the virus. It remains that the only response that we have, and as a government, as a people, the scientific and clinical response, is to vaccinate yourself and be in that line of people for whom the virus is not as aggressive and as destructive as the line of people who are not vaccinated, where that is where most of the persons are being selected for the hospital care and the hospital units that are expensive to operate, limited in number, and of course where our greatest risks lie, and that is in overrunning our ability to provide health care to those who need it. Ladies and gentlemen, we will continue to offer the vaccine. We will continue as a government to have supplies available. We will continue to give top priority to our children, their protection and their schooling. And that is what we do going forward. So if you have any more questions at this time, we have 15 minutes for your section of the press conference. Oh, sorry, there's some adjustments that we need to make. I should tell you that now, because you may form part of you. We did open up the food service sector, and we will continue so to do. And today we want to indicate that persons involved in restaurants and bars, you are offering a partial service now, that from the 1st of November, which is 2 weeks from today, 14 days from today thereabouts, you would be allowed to offer full service at your bars and your restaurants. And that's the same thing occur, go to casinos and cinemas. And of course, that's for vaccinated people. Full service for vaccinated people. We had been lobbied very heavily for the last few months, I would say, the Minister of Trade and her friends and associates in the horse racing business. And the minister, I don't know if he's a punter, but horse racing can resume to vaccinated patrons. So you can have horse racing, and in the stand, you allow vaccinated persons to come in, at least for now. Religious services, we want to extend the time with which you can spend in the churches and mandirs and mosques and wherever you worship to 90 minutes. We will preserve for the moment the numbers. We give you 25% of your capacity, but we give you a little longer time, because I understand that many of the ecclesiastical bodies are streaming their services and so on, so you can do a longer service as against larger numbers of people coming out to church. And that is, again, for the time being. The public service is put on notice that from November 1st, we would be calling public servants back out to work in an organized way, and hopefully by the middle of November, towards the end of November, most, if not all, public servants should be back out to work in full. And the Tobago Air Service should go back to normal capacity from next week, or as soon as Carl can put that in place. We are observing the science and authorization with respect to the use of boosters in the vaccination program, and we will be guided by the health department on that and the international clearances where they come. And we will also, as I said a little while ago, be following very closely whether vaccines become available for children ages 5 upwards. Well, we have public events at 50% capacity indoors, and we expect that those will be utilized wherever they are, whether it is the various centers, Queen's Hall, Sapa, Napa, places like that, gatherings, right? Something I did not get a chance to raise with my colleagues today, but I think I'll take the opportunity to do it alone. And that is, we have gatherings, the legal gathering is 5. Yes. I would like to ask that be raised to 10, right? Gatherings are, in public, out of 10 people, so take a little more, get a little more grouping, slightly more. But while you do that, just remember, the wearing of the mask is still one, the cleansing of the hands, the use of sanitation, and of course you get a little respite in groups. We are expecting that by the end of November, the vaccination program should have vaccinated a few more people. Given what we have given who is out there, or what you're doing now, we think it is possible to vaccinate another 100,000 to 200,000 people by the end of the year. That will take us up to just over 800,000, and that's people vaccinated. And if we optimistically add to that persons who are self-immunizing in the population, asymptomatically, a fair amount of people should have been exposed to the virus, and so therefore our population as a whole, in terms of induced immunity and natural immunity, should be somewhere approaching the target that we had set of approximately 900,000. These are our optimistic arrangements going forward. So let me just stop here for now and allow you to ask a few questions, because we're going to have to ask you to stop at 3:30. So please identify yourself and put your question.
Sure, for questions, this is from BT News. In terms of funerals, any clarification on that? Is it still 5 or 10?
No, funerals, we had moved that away from 5 before, right? But in the church service, we're still at the capacity of 25% of the capacity. And the reason why I didn't raise that, because Tobago had led the charge on that. No matter what number we put, there's a cemetery in Tobago, which always seemed to attract large numbers of people. So what we had done, we had left it. If the church service is 25% of the capacity, then most people don't go to the gravesite, but some people do. But we're still observing reduction of numbers at the gravesite. So let us be guided by what goes on in the church or whatever, mandir or mosque or so, and not gather in large numbers at funeral sites, at least for now. Yes?
Good afternoon, Urvashi from TV6. In that same vein as Kimberly, I didn't hear you mention team sports or beaches.
We're not there yet. We have considered both, but we believe that because of how many we have released out in the food service sector, the school, and other aspects of opening up, that the pleasure section we hold for another few weeks. But we anticipate, I hope I'm not talking out of turn here, we anticipate that we are not too far away from the opening up of beaches and team sport, outdoor team sport.
And while I understand the reliance on the WHO for guidance, given that we have limited vaccines, and you greatly described it as a pandemic of the unvaxxed. Most of those unvaxxed, or a lot of those unvaxxed, will be children. Is there a possibility that we could rely on the expertise of our local CMO, Dr. Hines, Dr. Nandra Mandin, to decide whether or not we can do like 7 other countries and OK Sinopharm, which is an inactivated virus, for children?
Well, we do rely on the expertise of our, while I'm the spokesperson for what is said from the Health Department in Trinidad and Tobago, that comes from, largely from our input from our health people who put to the government, and the government has to make a decision. Our decisions, it is not that they give us instructions what to do. The Health Department advises the government, and the government respect the advice and make decisions based on that. And we've had it's now almost 2 years that we've been doing that, and it works very well. In terms of the acknowledgement of the authorization by the WHO, as a government, we will maintain that level of guidance for all kinds of reasons. Right? I know there are countries, either some countries that would not or cannot get WHO approval for one reason or the other, and we also know about the issues of vaccine diplomacy and vaccine politics, and that plays a part in it. Some countries have used vaccines that have not been authorized. We are not one of those countries. We are a member of the WHO. We have a vaccination program that goes back for decades, and COVID is only one rung on that ladder. I have no information to share with you that the government intends to use vaccines that have not got the sanction of WHO.
Good afternoon, sir. Shane Spurrier from the Newsday newspaper here. Recently it was reported, I think it was a company somewhere in Chaguanas or Central, that had, I think it was a wristlet that displayed the vaccination status of some users. Just wanted to know, going forward, would the government be opening to having more partnerships like this with the private sector and the business community as far as, the vaccination drive is concerned?
Well, sure, we have been cooperating with the private sector extensively, but I'll ask the Minister to respond to that.
Thank you. So we saw it, and unfortunately, some people sort of make a link between the bracelet and being approved by the Ministry of Health. We did issue a statement yesterday stating that the Ministry of Health, as you know, is partnering with the Ministry of Digital Transformation to have an e-vaccination card or e-vaccination validation on your phone. We are working with that. Minister Young did see that a couple weeks ago. We have not partnered with any individual on a vaccination bracelet. We are working towards e-vaccination proof on your phone. That is what we are working towards at this point in time.
Let me just say, the answer to your question, therefore, is yes. But it's an area that is open to abuse and criminal activity. I just want to remind the population, or any person who is so minded or intending to do it, that to offer or to pretend to offer vaccine certification by document in any form, representing as though it has come from the authorities, is a criminal offense. So in other words, in short, if it is not an authorized arrangement authorized by the authorities, and you try to offer it, whether it is by armband, wristband, or by card, that's a criminal offense. So please do not see opportunity to falsify things of that nature so as to allow persons to pretend to be vaccinated when they're not. I just put that out there as a reminder, and the penalties are very severe.
And PM, let me just say that the Chief Medical Officer will advise the public health inspectors and the TTPS to look out for this in the safe zones. So let me alert owners who are operating under the safe zone policy that that bracelet is not authorized by the Ministry of Health. It is not proof of vaccination, and you should not be accepting it as proof of vaccination.
Just 1 second, please, Minister.
I just want to add to the conversation, Prime Minister, Minister of Health. This is an evolving process, and the technology is an evolving technology. What the Ministry of Health and the Ministry of Digital Transformation are working towards right now is, as the Minister said, a certification that is going to verify our local vaccination program. That is going to include a QR code. So some of this technology that people are offering now is premature. But when we get to the point where you can get from the Ministry of Health, through the digital transformation team, that vaccine certificate that validates your vaccination status, it will include a QR code. Thereafter, some of that type of technology may be available for persons to utilize, but we're not quite there yet. We need to provide you with your validation certificate. As the Minister said, one of the ways we're looking at, you'll be able to show it on your phone. That does not preclude the evolution of potential technology, but we're not there yet.
Yes.
Prime Minister, good afternoon. Charlene Rampersad from Guardian Media. You spoke about public servants. Will those public servants be required to be fully vaccinated before returning to work?
By the time we get there, we will answer that question. Oh, sorry. By the time we get there to talk about public servants coming back out to work in full, we will discuss that, but at the moment we have not made that mandatory. Public servants are out at work. A significant amount of public servants are out at work, having been vaccinated or not vaccinated by their choice, as the rest of the population. So that does not, that will not impinge on the others who are likely to come out. Public servants, for the moment, are not identified as a group for any mandate at this time. They are being treated as part of the larger population. Either some are at work, some are at home. Eventually, in the next few weeks, they'll all be out.
Something, Prime Minister, you said 2% of the people in hospital or who have died were fully vaccinated. Is it those who are in hospital or who have died?
I think I better let the health department answer that.
Let Dr. Trotman answer that, because what is happening, we tend to focus on the exception and not the rule. And it was unfortunate the way that story was carried this morning, because it focused on the exception and not the rule.
So 2% of those who have died, that is the answer, and 5% of those who were hospitalized. I want to take the opportunity to mention about the relationship of COVID deaths, COVID positivity, and dying. Not all patients who actually die and are COVID positive would have died because they are COVID positive. And if you would permit me, some people are coincidentally have COVID positivity and unfortunately have passed away. So they may have advanced cancer, they may have other types of diseases, and unfortunately are at end of life, but also contracted COVID. So the reason why they died is not the cause, is not COVID. They would have died from other things. So there are causal relations. You died because of that. I exercise and I become tired. That's a cause, it's causal. But I have something else at the same time. It means it's correlated. Doesn't mean that it's the cause of that. And we need to understand that separation, which will not always come out. You just hear somebody is COVID positive and they died. And always public, we are always mindful of the fact that we know, we the treatment team know, and we see that those people who come in largely are unvaccinated. So please remember that apart from the basic principles upon which we stand, washing our hands, watching our distance, wearing our masks, please go and get vaccinated. Thank you, Prime Minister.
Just a point of clarification, Mr. Prime Minister, that 2% would include people who would have died before the vaccine was available?
We would have started to count not at that, say, from that period of time, but we can provide you with the specifics of the time from which we would have started the actual statistic.
And if possible, Dr. Shotman, will we be able to get data on vaccination by age? Because a stats lecturer of mine was concerned that deaths in the over 65 age group seem to be consistent, and he was concerned as to whether they had been vaccinated.
So of course, we will try our best to provide that information. But when you start to break things down by age, remember there are other factors going on, yes, with people over. So look at how we interpret even that information. Thank you.
Mr. Prime Minister, I have one more question.
Thank you, Dr. Shotman.
But it would be for the CMO. I was wondering, how come when P1 was introduced to our population, we saw a spike in cases, but now that Delta is present and in community spread, we're seeing cases more or less plateauing? Why haven't we seen a commensurate or consistent spike?
We had a good discussion about that already, so we have an answer for you.
So yeah, good. When P1 when introduced, our vaccination rate, if I remember right, was extremely low, correct? P1 would have been introduced somewhere around March or thereabouts into the country. Two differences. P1 is much less transmissible one. Our vaccination coverage was extremely different, almost less than 10%. Now we're over 40%. We have the P1, which also is a confounding factor in the way it competes with each other in circulation. We have, as Prime Minister said, a portion of the population who have now been more infected than would have happened in March. So let us go close to somewhere between 50 and 100,000, more or less, if you look at asymptomatic spread, suspects, and those kinds of things. So you have to put all of those together. We are in the early-ish stages of Delta into the country, looking at somewhere between a month and 6 weeks, roughly. We haven't necessarily seen the full effect of Delta as yet because of those factors being all occurring at once. P1 vaccination rates increasing. We still have masking in place, so we have public health measures in place. So we are being optimistic that we can maintain the plateau as it is going. However, we have to keep a very close eye on it, and we have to be cautious because as we have seen in other countries, as Delta increases in prevalence, and what we are noting is that we have increased numbers of cases being picked up by the University of the West Indies as the days go by. We have 75 confirmed cases of Delta, and as you pick them up more readily with the same sampling methodology, it means that the prevalence is increasing in the population. So we're increasing in prevalence, we're increasing in vaccination coverage. All those factors go together. We're at a very a difficult situation where you're balancing all of it at once, and we have to really still keep a close eye on it to ensure that it doesn't run away and become a spike as we have seen in other countries. So it's a balancing exercise in terms of public health measures, and it is a very complex scenario in terms of the way variants of concern interplay with other variants of concern, vaccination, and all the other confounding factors.
I think this is, thank you, Dr. Parasam. I think this is a good time to make this point. A lot of the bad things that have not happened to us is as a result of the difficult things that we have done. Some people are taking the position, well, since we are not in a calamitous situation, what are we doing this for? Why don't we just go like if there's no problem? That is the completely wrong way to look at it. It is because of some of the things that we have been doing why some of the results are what they are. And if those results are in fact attractive, we don't give it up by not doing the things. For example, the management of our children. Had we not kept children home and gone along like normal with schools, it is clear that a significant number of our school-age population would have been infected, and worse, they would have taken COVID home to people who are vulnerable, and we would have had a bad result. And that is the kind of result that populations in the world had in the early days when COVID was not so easily understood. In the very early days, it was deaths that caused people to close down countries and close down this and close down that, because people were dying so frequently from the infection that the response was the closure. But before that, that mixing with the population and that getting infected and taking it to vulnerable people, we didn't know that yet. And that was found out in a very hard way by some countries. We are walking gingerly based on the information we have, the vaccines we have, the population response and so on, and hoping not to get that kind of outcome.
Prime Minister, if you allow Dr. Trotman, because we did speak about this, to speak about the cases of Missy that we are seeing or not seeing since we started the vaccination program. Missy would have affected a lot of children in Trinidad and Tobago before the vaccination program. So let Dr. Trotman.
So just a hint, as you know, COVID-19 can affect our children. We have seen cases of effects in children, and one of which is Missy, which is a system where many systems are affected, most often the heart for children. And for those children that we have seen, the predominance since the COVID-19 vaccine are in those that are less than 12, hinting that maybe within the vaccination process of those over 12 that we could be having an impact. We always don't want to see COVID-19 at all. We don't want to see it in adults. We never want to see it in children. And as heartbreaking as a lot of what I have to tell you is not as heartbreaking as seeing a child who is ill. So I want to take the opportunity to again encourage parents that when it is said it is okay, and it has been said it's okay for those children over age 12 to be vaccinated, please do so and avoid complications like Missy. Thank you.
Well, if there's one more question on this, because we crossed the time, I said 3:30 is now 5 minutes beyond. So we take one more question on the medical side, and then we'll ask, we'll change. Anxious. Okay, at this stage, I want to thank Dr. Parashram and his team for once again coming out and staying on the job. The population thanks you most sincerely, and we look forward to seeing you again very soon with the good news. Thank you very much. So this is where we get to phase 2. And I noticed that there's a certain amount of anxiety to get to phase 2. It is maybe because of where we're at in Trinidad and Tobago. Permit me to identify myself to you for those of you who have forgotten who I am or didn't know who I was. I am the Prime Minister of Trinidad and Tobago, and there's a government in Trinidad and Tobago. It's a PNM government, and Trinidad and Tobago has a government in place. One would not have come to that conclusion if one had landed here from Mars yesterday. Let me just tell you why I think it's necessary, because if one would have followed today's news and yesterday's press conference by the opposition leader, let me just take you down memory lane as to where we are supposed to be according to the UNC view. The view of the UNC, led by the opposition leader, is that the president is to be impeached, meaning that steps have been taken to remove the president from office for some element of wrongdoing. The Prime Minister is to resign. The Attorney General is to resign. The judge is biased and is to be dealt with later. The Chief Justice is implicated because the judiciary is somehow identifying people by their political color, and they are not getting the benefit of the Constitution. The Deputy Commissioner, Commissioner Jacob, gone, to quote the opposition leader. And there has been a breach in the separation of powers, meaning that the Parliament, the judiciary, the Prime Minister's office, service commissions, they've all now, there's no separation there, or in some instance where they have found that the wall has been breached and separation of powers. And of course, if we add, there's an election in Tobago, and the Election and Boundaries Commission has received from the UNC its pre-action protocol, and the Election and Boundaries Commission is to be taken to court. Those, and of course, there's no Police Service Commission. Those are the 9 items of the condition of Trinidad and Tobago. Condition number 10 is that there is a crazy opposition leader in Trinidad and Tobago. So those are the 10 points that I think would form the basis of our press conference today. Let me just, before I go down further, ask of you, members of the media and the population, who would have seen at that press conference of the opposition leader yesterday where she read out the epistle of the offenses of the president requiring a tribunal to be put in place to consider the removal of the president from office. What exactly has the president of Trinidad and Tobago done that warrants impeachment? And I am not here talking about stories in the newspapers about who visit whom, what might have been said. If it was so, it seems, I think so, or I believe so. I am here talking to the population to tell me specifically, what do you know that the president of Trinidad and Tobago has done that requires impeachment? So if you, as members of the media, know that when it's your turn to speak, I'll be very anxious to hear that. I know that the requirement for the Prime Minister to resign is an ongoing requirement where the opposition leader is concerned. And as for the Attorney General, that dates back to maybe since he was a boy. And as for the judge, that dates back to when she married her husband, and of course, when she made a decision in the court and so on. So those can be found. But let's start with the question of separation of powers. I have observed, particularly from some persons who believe that their opinion is greater than other people's opinion in this country, and rather than be responsible and provide professional guidance to the population, general mischief making seems to be, where they are located. The population has been disturbed for the last 2 or 3 weeks on this question of breach and separation of powers. I have addressed this matter here before, without going into much detail, that this question of independence, when you talk about this independent commission, and independent this and independent that, for the man in the street or the man in the taxi going to town, that independence has in it, even in law, it has in it a certain element of interaction. There's no public entity that is cloistered to independence. I've seen people asking, they want to know if the Prime Minister went to the President's house. And until the country knows that, we will not know if our democracy has been breached and our democratic future is in peril and so on. Absolute hogwash. And misleading people who rely on them for guidance and get that as professional guidance. I took 2 oaths of office. One at President's house to be Prime Minister, and one in the Parliament. And under my oath of office, as long as I hold this oath of office, I am required by law to communicate with the office of the President, by law. The fact that some previous Prime Minister saw it fit not to have a relationship with the President, not to communicate with the President, to denigrate the President publicly, if that was their style, that does not now exist in Trinidad and Tobago. What exists in Trinidad and Tobago today is a good working relationship between the office of the President and the office of the Prime Minister. And it is the decision-making of offices that is to be independent. The obtaining of information does not request independence and cloistering. So, in terms of telling the population that you want to know what happened on some date at the Prime Minister, at the President's house, I could say to you now, members of the population, that I go to the President's house whenever I'm required to be there because there's something I want to tell the President or is something the President should know. I speak to the President on the phone, and if there's a situation that I think in my capacity and in my judgment that the President should know, I am duty-bound under law to do that. And interestingly enough, if the Klankatang and the, what they call the imbroglio was about the President not being informed about something, it would have been the same people who would have been making bacchanal that the President was not properly kept informed over X, Y, Z. Insofar as what goes on between the Prime Minister office and the President's office, a lot of that, for good order in this country, is in secret and remains in secret until either of these officers deem it fit to tell the population what the conversation is. But for someone to be demanding that the Prime Minister tell the country what took place as a conversation between myself and the President, it's just mischief-making nonsense. It's not meant to be that way. It's not in law to be that way. And nobody could tell me while I hold this office and took that oath that I want to know what you tell the President. And since I don't know what you told the President, I will make up all kind of story. And then when I make up my conspiracy theories, I then exercise the country over that. What you have done is disturb the country's psyche. And of course, a lot of what has been published in the last few weeks have been published with, if that is so, then so. And it starts out with the usual phrase, I don't know but. And because I don't know, I am free to fabricate any story and then serve it to the population until it gets to the point where we're now talking about impeaching the President because I don't know what went on between the President and the Prime Minister. Them is mad people. And according to Lloyd Best, them is people to watch. Because, you see, let me just dispense with one or two of the things. I am not sure what date you're talking about, but I've seen it put out there as part of the population's disturbance that the Prime Minister bullied the President into making some decision with respect to what the Police Service Commission did. I want to categorically deny that I had anything to do with the relationship between the President and the Police Service Commission, and any action of the Service Commission in its relationship with the President. I've seen one senior counsel, who shall remain nameless for good reason, knowing nothing about these matters, expressing an opinion that there was a tripartite meeting between the Prime Minister and the President and the Chairman of the Police Service Commission, and therefore there was interference and la 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 la. Absolute falsehood. No such meeting took place. And I'll go further. I have never involved myself in any selection by the Police Service Commission of any list. I have seen no list, whether it is substantive posts or acting posts. I've seen no list. All of that business of the state would have been between the Police Service Commission and the President. And of course, as Parliament, we did intervene later on, indicating to you that it came to our attention that an error has been made. It was I who on this platform told you a few weeks ago that the trouble that we were facing then was largely as a result of a series of legal interpretations. There are as many legal opinions as there are lawyers. And what does one do? In this situation, there were about 5 positions of lawyering that were coming to us. And for the benefit of the public, let me explain to you. The Police Service Commission had their lawyer. The President's office has a lawyer. The Attorney General has a lawyer. The Prime Minister's office has a lawyer. And of course, they all had different opinions as to what was right. It was against that background that I told you a while ago that the government, looking at this scenario, sought from the National Security Council an independent senior counsel of great standing to advise as to whether or not certain actions of the Commission had in fact been properly done. We didn't have the answer. Senior counsel gave us answer, and I mentioned to you that the advice from the senior counsel was that there were errors made and what has been done cannot stand. And by that time, lawsuits were in the courthouse. And I said to you that the government's position, which will be advanced by the Attorney General, is what will be in the court from the government's legal understanding, having taken it from eminent senior counsel. And I told you, don't panic. Nobody is panicking. Our institutions are strong and they will hold. And what we will do is to work our way out of this by the institutions doing what they have to do. So whether it is the President's office, whether it is the Service Commission that has to do certain things, whether it is the Prime Minister's office, whether it is the National Security Council, once we do what has to be done, there is no crisis and panic to be had in Trinidad and Tobago. But of course, that was too enticing for the leader of the opposition, who of course misses no opportunity to make bacchanal in this country, even when she doesn't even know what she's talking about. So today our country is facing a situation where a motion is filed in the Parliament, and the opposition leader takes great pleasure in having done that based on, I don't know, I think so, if it is so, it seems so, I'd like so, somebody here so. So let's impeach the President. And of course, she and her 19 imps, what is it, imps, pimps and chimps, they put their name on a list and will come to the Parliament and debate the conduct of the President. It is for good reason that our Constitution says that the action of the President cannot be queried in a court of law, because they want to save us from ourselves. But the opposition leader wants to get around that by bringing the President's name into the Parliament in a substantive motion so that she and her imps, chimps and pimps can scandalize the President in the worst way. Well, the UNC is a part of the politics of this country. We are not. We are the PNM. And we will have none of it. And she has no idea what the Constitution says. Walking around this country, self-appointed senior counsel, talking about going to debate. Debate what? She doesn't even know the Constitution. But she probably thinks she sees an opportunity to scandalize the President in the Parliament. And those who have been following that foolishness, because you have not been party to conversations behind closed doors in this country. Let me, driven in this situation, to tell you something that you don't know. And that's all I'm going to do today. I see it being said that all this bacchanalia, when the amendment came to the Parliament to allow the Commission to proceed towards appointing a Deputy Commissioner for the Police Service, it was said by these very people that that amendment was meant to keep the Commissioner of Police that we had. That was the accusation that was made. But by the time the thing worked itself out to where we are now, with a ruling from the court where that commissioner cannot be considered as been done by the commission, the question now, the answer now from the opposition is that we want to get rid of the Commissioner of Police. All I will say to the opposition is choose a side. You can't be talking out of both sides of your mouth on the same issue. So, I see it being said that any communication between the Prime Minister and this independent Police Service Commission is an interference of the work of the Commission. Once again, I want to say, hogwash. The Police Service Commission has as its duty under the Constitution the disciplining of the Commissioner of Police and the Deputy Commissioners of Police. Appointment and discipline. Those four officers, they fall under the Police Service Commission. Other officers in the police service, they all fall under the Commissioner. I was in the Parliament when they changed that and put that in. That is the law. That's the law. So if that is the case, you have a Prime Minister's office that has within it the responsibility of the National Security Council, chaired by the Prime Minister. And you have a commission over there that has that kind of rule for the commissioner and the deputy commissioners. And somebody will tell you that there's a wall of China, a great wall of China between the two, and near the two shall meet. Well, if according to them, they want to know, they want to unmask the Prime Minister to prove that the Prime Minister met the chairman of the Service Commission, well, I'll tell you all, I'll follow their advice. Whenever I'm going down to Hilo or to Price Mart or going anywhere of any to a show somewhere, I'll check first and see if the commission, any independent commissioner will be there, or the chairman of any of those commissions will be there, because I might meet them there. And such examiners will say that I met them somewhere and I told them something which caused them, having been told something, caused them to think differently. Because apparently that is what the story is. They were caused to think differently because they met the Prime Minister. And the Prime Minister ought to have nothing to say to the Police Service Commission because they're independent and they ought to be. But let me tell you all something. I don't have to peep behind any posts to communicate to the Police Service Commission or any commission for that matter. My duty, my job gives me that authority. And of course, I don't have to pass through the president to get the president to get any commission to do anything. I can go directly myself in writing, as I have done 3 times. 1 year ago, in my capacity as Prime Minister of Trinidad and Tobago, I wrote to the Police Service Commission a letter under my hand with my signature. And the most important thing I could do as Prime Minister of Trinidad and Tobago is to attach my signature to any document. That letter was a letter indicating to the Commission that as Prime Minister of Trinidad and Tobago, I had lost confidence in the Commissioner of Police of Trinidad and Tobago. That's 1 year ago. Secondly, recently, after information came to me and a subunit of the National Security Council, the outcome of that was that carrying my duty, doing my duty, I had to submit the minutes of that meeting to the Police Service Commission. And thirdly, As I told you all publicly, the government sought and obtained legal advice as to whether the commissioner was properly appointed by the commission. And when I got that legal advice, it was of such import that I realized that it ought to be made available to the Police Service Commission so the commission would know that the government has accessed advice of that nature. Those are the 3 pieces of correspondence, not peeping behind any post, not meeting the chairman under anybody's house, written to the Police Service Commission. And if you want to go and check the laws of Commonwealth and see if any Prime Minister has any right or any authority to communicate with an independent commission like that. And when you find that out, you will know the quality of the legal advice this population has been getting in the confusion that they've been making here. And of course, the big issue was, as I discovered after, in my communication with President House, there's a big issue which the population was not aware of. I, as Prime Minister, wasn't aware. The Attorney General wasn't aware. The opposition leader wasn't aware. The first person who pointed out to me what she had discovered in her office, what the judge ruled on Thursday, was Her Excellency the President. Doing her job in the highest tradition of office holding in Trinidad and Tobago, I can tell the population now that that matter of the appointment of people to act temporarily as police officers, which has been going, Commissioner and Deputy Commissioner of Police, we have been going along here since 2009. It was Her Excellency the President who pointed out to me that that legislation of 2009, and of course followed by the one of 2021, the subsidiary legislation was at variance and did not comply with the parent legislation. And if these mischief makers had looked and see what the President's position was put in the court by the Attorney General, the rubbish you got yesterday from the opposition leader you wouldn't have had. And the attempt to denigrate the office of President and to discard the President as somebody who doesn't find favor with the opposition leader. I want to remind the opposition leader, with all this concern you have for national security and for institutions, you are the person who appointed Reshmi Ramnarine in charge of the SIA in this country. The Prime Minister then hadn't yet warmed the Prime Minister's chair when she appointed a telephone operator in charge of the country's security intelligence agency. She was Prime Minister when the Speaker of the House came to the Parliament. A motion against the Minister of Finance was in progress. The Speaker got up and lied to the Parliament that the judiciary had written to him saying that the matter was sub judice, and the Speaker then summarily stopped the debate. Yesterday, she was making big carrying on about is the first time that a president is being impeached. We had bigger first times than that. The first time that kind of horrible development here was when the Speaker of the House lied in a debate that he's not supposed to even be involved in and stopped a debate where $400 million of taxpayers' money was at stake and the conduct of that officer was being examined. So I want to tell the opposition leader, don't expect me as Prime Minister to do my job the way you did yours. When she was Prime Minister, for months and probably years, she wasn't seeing the President and talking to the President. I'm coming to tell me now how to do my job. I am taking no advice from the opposition leader. She is not competent, and she just reads what people write for her. Otherwise, she would have known what she said yesterday didn't make any sense. She made a big to-do. Jacob gone. Where has Jacob gone? Under the laws of Trinidad and Tobago, Deputy Commissioner Jacob has been properly appointed by the process in the Constitution. So therefore, no amount of development subsequent to that can change that. He was made to act as commissioner, and that turned out now to be a problem now that the court has settled that matter. But what does the opposition leader come and tell you? To create confusion in this country. This one gone, that one gone, this one gone, that one gone, and nobody in charge of the police service. And giving you all the consequences of that. Absolute nonsense. as I said before, yes, there is no commissioner in place. And the commissioner was serving as the accounting officer. The minute the court ruled that there was no acting commissioner of police, all that had to happen, the Minister of Finance, under law, as he's authorized to do, is simply assign the role of accounting officer given to him under the Exchequer and Audit Act to another officer. And that was done within hours. So I don't know why the opposition leader thinks that because she doesn't know the law and because she's a 2x4 self-appointed senior counsel, that she could give advice to this country on matters of law. There is an accounting officer, so all those who were talking about you can't get pay sheet signed, you can't do this, you can't do that, from an accounting standpoint, that is not true. And you would think somebody who was Prime Minister, somebody who was Attorney General, somebody who was a Minister of Government, somebody who is opposition leader will know this. It's either she knows it and she is deliberately setting out to cause janjat in this country, or worse, she doesn't know. Could you imagine that we have to conclude that a senior counsel does not know that if an accounting officer anywhere in the government service for one reason or the other can't function, the Minister of Finance is authorized under the Exchequer and Audit Act to appoint another accounting officer? So what's all this confusion being generated about? I did say to you earlier on, when I told you an error was made, I said there will be consequences. I did not, I must admit, expect that the consequence would be this reprehensible conduct of the opposition leader, trying to create as much mischief as possible and denigrating the president as she's attempting to do. Well, we are there in the parliament. The PNM is in the parliament. And the parliament is not a place to go on a fishing expedition. If you have evidence that the president has done something wrong, then tell the country what she has done wrong. Don't come and tell me that you think that you should know what she said or what she did, and can't tell me what she did, but you're going and triggering impeachment. State the fact of the wrongdoing. Let everybody in Tobago, in Point Fortin, in Toko, out at sea know, well, the president has done so. And as a result of that, she's being impeached. Don't sell our country short. And don't come and tell me this prominent busybody lawyer say, maybe this is what happened and maybe. We cannot run this country on maybes. And conspiracy theories that 10 a dime in this country. And the opposition leader loses no opportunity to make confusion in Trinidad and Tobago. No opportunity she misses. And even when there isn't an opportunity, she tries to create an opportunity. And yesterday was the worst. So now the Speaker is called upon to convene both houses of Parliament because the opposition leader decided that the president must be impeached. For what? For a fishing expedition to determine if the president and the Prime Minister talk and what they said. Would you believe that? Would you believe that? Because you don't know what was said between the president and the Prime Minister, you're going to impeach the president. That is the same opposition leader. In fact, I better not say that. Let me leave it that way. If you have any questions, I'll take them now.
Mr. Prime Minister, well, a lot of the questions that the opposition leader would have asked yesterday, you did in fact answer today, because she asked, about...
She wasn't asking questions, she was making confusion. Just remember that the opposition leader is a senior counsel, a former Prime Minister, a former Attorney General. A lot of the questions she raised today reside within the knowledge and or expected competence of somebody who served as Attorney General and as Prime Minister. Even if she doesn't take her duty as opposition leader seriously, she hardly comes to the parliament. She takes part in nothing, right? And whenever she does, she just reads some foolishness that somebody write for her. But she is a former Prime Minister. She's a senior counsel. So those are not questions. Those are issues raised to make mischief. And the level of bile that she sprayed at the president is unbelievable and disrespectful.
Of course, Mr. Prime Minister, you just to repeat, you categorically denied that any meeting took place between yourself, the President, and the police service.
I didn't say that. I said I can go there 7 days a week, 24 hours a day, and speak to the President as much as I like and talk with anything I want with her. And I am under no obligation to tell you until I or the President think that it is something for public consumption. It's a country running here, not a parlor, you know.
But of course, Mr. Prime Minister, you said that meeting did not include anybody else.
There was no, I told you, I saw a senior counsel in your newspaper, one of them, saying that there was a tripartite meeting between me, the President, and the Commission. I'm saying to you, that did not take place.
Fair enough. But of course, at the end of it, Mr. Prime Minister, the information in the public domain is that the President would have received an order of merit list.
I cannot speak to that because I was not part of those discussions and it's not part of my remit.
Do you think by not forwarding an order of merit list, she would have disregarded?
I am not speaking to that except to say that it was found by law that if that was received as coming from the Commission purporting to carry out that action, it required an action of the Parliament. I told you before, senior counsel confirmed that to us, the government agrees with it, and we act on it. We went to court and told that to the court. So what happened at the court, the government has no issue with.
But are you concerned that a list was received and not sent to the Parliament?
I am concerned about everything. I'm Prime Minister of Trinidad and Tobago. There's nothing I'm not concerned about. As you sit there right now, I'm concerned about your well-being. I'm concerned about your health. I'm concerned about your economic standing.
Hi, good afternoon, sir. Just wanted to know earlier in your...
Sorry, I'm not hearing you.
Shane from Newsday. Just wanted to know, earlier in your address, you would have said that you had no confidence in the former Police Commissioner Gary Griffith a year ago. Just wanted to know what would have prompted that.
My judgment.
Prime Minister, was there any specific incident?
Listen, there are things that I deal with publicly, and there are things that I do not. I have no publicly stated that. That's a year ago. I could have published that letter a year ago. I could have told that a year ago. I did not. I tell you now, if only because of the situation that exists in the country. I started out by telling you what some people think the country is. And in that environment, especially given the interpretation and the conspiracy theories that are going around, and the role that I'm supposed to play. I only mention that in the context of my role as Prime Minister and my relationship that I should have with an independent commission who is responsible for another piece of the governance of this country.
In that same vein, sir, I know that Mr. Griffith would have posted a video on social media in response to Justice Kangaru's judgment, saying...
That is a matter for Mr. Griffith and Justice Kangaroo. I do not come out into areas which are not my remit to answer questions about other people's behavior or other people's responsibility unless I have to. And that is not something I have to respond to.
Even if it's alleging,
that is not something I have to respond to.
Mr. Prime Minister, where are we in the process of getting a next Commissioner of Police, and where are we?
Okay,
when can we next...
very good question. Actually, very good question. That's the point I was making all along. And let me tell you where we are. One, the Police Service Commission, they've all resigned for reasons given and not given. So therefore, there's a requirement under the Constitution for there to be a Police Service Commission made up of a chairman and 4 others. That commission is appointed by selected by the President, who will then advise the Parliament that these are the people for consideration. It is then for the Parliament to either accept or reject. I can tell you, if I'm to share tales out of school, because I've been apparently now it's premium, that I have no doubt that President House would have been seeking to fill those vacancies. We at the Parliament, I am required in my capacity as Prime Minister to be consulted. I have been consulted. I am being consulted because names are being put forward, and the President will get a response, as the case might be, and names will come forward to the Parliament. I said publicly, I think I said publicly that as soon as those names are in the Parliament, the government will take steps to treat with the matter with dispatch. That was published coming from me. So that's where we are. steps are being taken to appoint a new commission for the police service.
If we could just go back to this motion, it needs a special majority, if I'm not mistaken, to survive, and the opposition leader suggested that the whip be lifted. How do you feel about a conscience vote?
I am not going to engage in matters of general folly advanced by the opposition leader. And I do not advise myself on matters of law. I always take legal advice when there are matters of law. So if you excuse me, I'll leave the opposition with a motion. I told you that the UNC making mischief in the parliament, but the parliament also has the PNM.
My final question, Mr. Prime Minister, is how many appointments are now void within the TTPS? I don't know if the minister will be able to answer given the judgment.
Put the question again, let me hear you.
How many appointments, or it would have been acting appointments, Minister, are now void within the TTPS given the judgment?
I get your drift. How many persons are affected? How many police service posts, how many posts in the police service are affected by the judge's ruling? I can say offhand that it would affect the Commissioner of Police. It affects the Deputy Commissioner who was acting as Commissioner. Right? And that is as far as I'm aware at this time. I heard the opposition leader saying that she called the names of Prince, she called the name, some other people. Don't take legal advice from the opposition leader. You'd be doing well not to take any legal advice from the opposition leader. She is 99% always wrong.
Yesterday, for the opposition's media briefing, you would have mentioned that in addition to...
Opposition what?
No, at the opposition's media briefing yesterday, they would have announced that they also received two names, I think a Ms. King and a Mr. Ian Alleyne, a criminologist, as potential candidates for the PSC. They don't seem to be signing off on it right now. I just wanted to know if you could give me a...
Let me tell you why. As you see again, the consultative process is one that has been going on for the longest while behind closed doors. But they just want to scandalize everybody. I have served as Prime Minister for 6 years. I have served as opposition leader for 5 years. This consultation is part of the process, and decency requires that it be done in some element of confidentiality. You don't want to bring people's name into the public domain if they are considered and not and rejected in the consultative process. I have signed off on numerous people. Some people I have not signed off on as giving my approval, but my approval is not all that is required. All that is required is for the president to consult with you. Why is the opposition leader taking the position that once the president comes to consult with her about somebody, she goes scandalizing the people's name? Why? She came out before yesterday's ridiculous press conference and made a meal of Mr. Koilas, saying that he cannot serve on a commission like this, Police Service Commission, because the Prime Minister welcomed him in a meeting. I can't remember that. And of course, he had some function for Faris. That was the basis on which Mr. Koilas was raised in public and made the subject of a platform by the opposition leader, forgetting that the said Mr. Koilas had served only recently on the Judicial and Legal Services Commission, where they appoint judges and discipline judges. So what is the point that the opposition leader is making? That if I discover that you are PNM, then I will denigrate you, I will drag you through the mud, and I will blackball you. That's what the opposition leader is saying. This is a country where the PNM has acted decently on matters of this nature. We have judges who came out of the parliament from the UNC side. We have chairmen of the same Police Service Commission that served in the parliament and came after that to chair the said Police Service Commission. The PNM never took the position being taken, but we are different. Orville, London and Tobago lost by 4 votes. Later on, the candidate who lost to him when he became chief secretary. The person from another party was hired in the London administration. Look at the very issue in front of us today. I, as Prime Minister of the PNM party, that is the government of Trinidad and Tobago, I hired a person who was a minister in the government recently of the said opposition leader. At that time, they couldn't find it fit to cast a vote in support of him, even though for 3 years this country didn't have a commissioner of police. You would have thought that they would have been moved to say, okay, we can put one in place now. They didn't. But now they think there is benefit to be had to come out singing and waving like Easter, Easter Sunday with palm branches waving about the best commissioner. If you hear them now, you wouldn't believe it's the same people who wouldn't cast a vote in the parliament so that we can get a commissioner. As a matter of fact, when we amended the law to allow the process of appointing a commissioner to commence, they took us to court, they took the government to court. The judge didn't strike down the law. The judge said, okay, since there's issue over the minister starting the process, take the minister out, but the law stands in place. Because there's a point of view in this country, let me say it, nobody can appoint him or herself minister in this country. You have to be appointed on the basis of, you get into the parliament, either appointed by somebody who represents people to act in that way, or somebody who is elected by the people to serve end up serving as a minister. But there's a view in some quarters that ministers of government are to have no authority. Because if you are a minister, you are guaranteed to abuse the authority or to do this or to do that, to do the other. That's the point of view. The minute you see the name minister in a law, take it out, take it out, take it out. And somebody who you don't know, somebody who represents nobody but themselves, you're quite happy for them to have the authority. But the people's representatives who offer themselves for office as the first step in the process, get in there to represent the people, you don't want them anywhere near. And that is the position of the UNC, because they know how they conducted their business in office. But let me just end on this note. All this rah-rah and janjat by the opposition now, and the opposition leader, has nothing to do with any commissioner and commission, because their policy was known to the country, was known, right? That if the commissioner is acting, he will function better, so don't worry to appoint him in a substantive post. And all that kind of nonsense, you and you. The opposition in Trinidad and Tobago is trying to create as much confusion and create as much doubt, especially on the legal side, because she is mortally afraid of the progress this government has been making with respect to fighting white-collar crime. That's the long and short of the whole story. And you'll hear more about it as we proceed. Right now, the opposition leader is desperate and fearful of the outcome, any successful outcome, with respect to white-collar crime. So you attack the judge, you attack the judiciary, you attack the chief justice, you attack the prime minister, you attack the attorney general, and just create one great mayhem. And in that scenario, people who have questions to answer in front of the court will somehow escape because you mash up the country. President to resign, and this one to resign, and that one to resign, and that. And when you create all them vacancies there, you will move into it. The opposition leader has taken no step to caution, to constrain, or to identify the criminals within her ranks. And I say no more. Thank you very much.